Happy Friday, everybody, and welcome to everybody's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, Alloclae is a cadaver harvested fat grafting injection. Would you get it? I'm going to tell you all about it. And then a plastic surgeon, me, is going to reveal what I think are the best traits to look for in a plastic surgeon. And then finally, we're going to play Spot the Lie Medical Edition. We're going to put these girls on the spot and see if they can see the lie. It's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. I'm your host, plastic surgeon Dr. Bruce Hermann. With me is Sarah.
Hi.
On this Thanksgiving episode, we're not actually live today. Sorry, the studio is closed, so this is pre-recorded. Not to break the fourth wall or whatever, but so happy Thanksgiving, everyone out there.
Yeah,
but we haven't had Thanksgiving yet. We're talking to you from the future, the past. Is it the past?
time travelers.
For time travelers. Okay, Brenna, save us. I'm really drowning out here. How are you?
Good. My birthday was yesterday. Well, I guess in this will be 2 weeks ago.
Was it? Wait, your birthday was yesterday. The real time or like?
Oh, real time. Sorry, no, the 19th. I'm now 23.
Happy birthday, Brenna.
Thank you.
Oh my gosh.
Happy birthday. I didn't know it was your
old.
birthday.
Yes, I know. I do feel old.
Oh,
Just kidding.
my
No,
gosh.
I went to Cheesecake Factory. It was nice. I got a free cheesecake slice.
Okay. I'm going to just say one thing about Cheesecake Factory. Their menu's too big. I couldn't even look at it all.
I was struggling, yeah.
It's really good.
And then
you don't know what you want to order.
And then I got my food and I wasn't even hungry. Which now I have it for lunch, but we had an appetizer. I ordered, I had two drinks and I was like, I'm full. I'm done.
I'm done. I'm tapping out.
Yep.
Well, happy
Anyways,
birthday, Brenna.
thank you. I didn't want to make this about me, but that's what's going on.
I'm glad to know it's your birthday. When's your birthday, Sarah?
That's in August. It already happened.
Oh, it just passed. Yeah, mine's coming up actually.
Oh.
Gosh, yeah, my birthday's in like 2 weeks. Didn't even think about that. Yeah, coming up.
But when this releases, it's in
next week.
Yeah, when this releases, it's like in like 6 or 7 days. Or I don't know. Heck, it's coming up.
You don't know when you were born. It's none of your business.
I don't even celebrate birthdays. In fact, I like wake up and like I'll have all these messages and like, why are people texting me? It's like, happy birthday. Oh, today's my birthday. I'm just not a birthday celebrator. So, all right, let's jump into these segments. So yeah, I love technology. I love new stuff. Sometimes I wonder if new products have a place. And this is kind of the case with this segment. So we're going to talk about Alloclae, which is an injectable cadaver fat graft.
Dead people's fat.
Dead people's fat. Would you have a dead person's fat injected into you?
No.
I feel like that's like the beginning of a zombie
It sounds like some zombie
movie.
So I actually think that this is a pretty cool product. But there is one problem with it, which we'll get to. So what is this?
It's gross. That's the one problem.
I look at that because we use cadaver products a lot in surgery. Like we'll use cadaver skin for various things. I mean, there's all sorts of cadaver products that are used in medicine that you probably don't even know about. So like I look at that, I'm like, okay, it's human harvested. So what? It's not like they're snatching people off the streets for this. I mean, it's sourced very ethically and legally and all that. So fine. Okay, so what is this? So this is a non-surgical fat filler that's off the shelf, which means basically it comes in a package and you just open it, which is sterilized donor or cadaver fat material. And it allows you to do fat injection without the need for liposuction, right? Because we've talked about fat grafting. You guys know what fat grafting is, right? You harvest fat from one area and then you process it and you inject it back in the body. The most painless of which is my least favorite surgery ever, Brazilian butt lift.
Yeah.
That's fat grafting. I use fat grafting for a few things, mostly for reconstruction, sometimes for cosmetic for breast. Fat grafting's fairly popular. It gets probably a lot more exposure than it actually happens. As much as you see about Brazilian butt lifts, they're done much less frequently than most other plastic surgeries. But this is a alternative to either traditional fat grafting or even fillers. Sometimes people use fillers for their face. Sometimes people use fat grafting for their face. So this is an alternative. And the advantages of it's non-surgical, right? Because if you're not doing liposuction, then you don't have to go to surgery.
Yes.
Right? So you could basically get fat grafting without having to have surgery, which is, I guess, a plus.
Yeah.
But then also, one of the issues I've always had with fat grafting is you'll get people that come in and say, I want to have fat grafting, and you look at them and they don't have any fat on them.
Yeah.
They're too skinny. So this does kind of fill that void where if somebody wanted to have fat grafting, but they just don't have any extra fat.
Yeah, like a skinny mini wanting a Brazilian butt lift.
Exactly, right? Yeah. Okay, so there are some advantages to it. Disadvantages, well, it does cut out the liposuction, which for some people is a downside because that's one of the nice things about fat grafting. It's like a twofer.
Yeah.
You lose fat you don't want, and it gets put somewhere you do want it.
Yeah.
And so if you go this route of using the cadaver fat, then you avoid that. But the other big disadvantage, which I'm going to talk about, is cost. Is this actually feasible to do for what it costs? Because that was my very first question. In fact, we had somebody come by our office with a fat, injectable cadaver fat. I can't remember if it was Alloclae or the other company that's out there. And that was the first thing I asked, like, how much does this cost? Because it's going to be expensive.
Yeah.
And will be cost prohibitive. So how is this obtained? Well, cadaver donors have their fat harvested. The fat's refined and is purified, but it does retain all the growth factors, collagen, and protein, which are things that you want.
Mm-hmm.
It's then all done. Now, by the way, all of this is done by FDA standards, so this is a legit product. That's
you can't find it at Home Depot.
You can't find it at Home Depot. I mean, that would be really weird, but no.
I know, but
but this is a legit product. A lot of times these products, especially more like wellness products, are not done by FDA regulation and standards. And so there's always that question of, was this really properly harvested or processed? You don't really know because no one's overlooking to see. But this FDA standard. All the donors are screened for communicable diseases, so like HIV, hepatitis B, Hep C, syphilis, those type of things, because you don't obviously want to get some terrible disease from your fat injection. It's then sterilized by gamma radiation, right? So they don't want any bacteria in it, so they sterilize it. And then it's sent out in these syringes, and the syringes come in 12.5 and 25 cc's. I think I put a picture in there, Brenda, of just the syringes to show what it looks like. Yeah, there it is. It almost looks kind of neon green. That might be the color of the TV. It looks kind of a weird color there. Does it?
Yeah, it's more yellow on my end.
Oh, it's more yellow.
Mm-hmm.
And in here it's kind of green. Okay, well, it does actually look like fat.
Looks radioactive.
And so, like, when you look at the volume of these syringes, because, I mean, you guys probably look at this and, like, is this a lot or a little? So compared to fillers, it actually is a lot, because most fillers, such as Restylane and Juvederm, come in vials that are only 1 cc. Like, when we're injecting lips, if you're getting 1 vial, it's 1 cc. It's very
But,
little.
like, whenever you inject fat, doesn't that, like, absorb back into your skin?
Yeah, it does.
And
it
doesn't
just
last
absorbs into
as
your body.
It doesn't, like, last as long. Yeah, into your body.
Sort of. You're on the right track. So when you inject fat, unlike filler, which when you inject filler,
stay.
When you inject filler, like, your body's not going to do like a sudden reabsorption. Whatever you inject is going to stay, but then over time it gets broken down.
Mm-hmm.
With fat grafting, it's kind of the opposite. You inject it and some of it will go away. You never get 100% take, but what does take stays. It doesn't go away over time. Because that's the thing with lip filler and cheek filler, the kind of the classic versions is you inject them and then a year and a half down the road, they're gone.
Okay.
And that's why fat grafting has gained some popularity with the cosmetic industry, is because once you inject it, as long as everything goes okay, it doesn't go away. It's there.
So do you like have to like kind of overfill whenever?
Yeah, that's really typical. If you're doing, that's exactly right, Sarah. So when you're fat grafting, you do overfill because you expect you're going to lose a small percentage of it. And so under ideal conditions, if everything goes perfect, you lose 20%.
Okay.
80% stays.
And then like for like in your face, people usually get it like in their cheeks or their lips or something.
I don't think they're doing fat injections in the lip. It's mostly cheek and just contouring. Just like as we age, it's commonly done with facelifts. And I don't really like fat grafting on the face, and I don't do it, but I mean, it's done pretty commonly. But yeah, it's done to fix contours. Like you inject the fat, and then of course you lose a little bit, so you might overfill it, but then whatever stays. So,
maybe that's what happened to Madonna.
I think Madonna got classic filler. I don't think she got fat grafting. Because if she got fat grafting, it wouldn't have gone away, and it did. It kind of calmed down.
This kind of reminds me, I don't know if y'all saw it, but it was this lady that got hair, like extensions or something, and it was hair from a dead body, and she got maggots on her head.
Oh,
it was like
gosh.
Yeah, I think it was on like, I don't know, there's probably an article on it.
That probably was not FDA.
Yeah, it was a whole lawsuit. And she was like, it's itchy, and then, yeah, it was maggots.
Oh my gosh, that sounds just...
Yeah. I was just like thought of that whenever you said coming from a dead body. I was like, oh my God.
I had times when I was working at the big trauma centers where patients would come in and they had maggots like in a wound or something. That's like very unsettling. Yeah, I've seen that.
So gross.
I've seen it 2 or 3 times. Yeah, it's a lot of times.
It's like a fear of mine.
Oftentimes it'll be like somebody that's homeless, you know, like they get a wound and then like they're not caring for it. Yeah, it's
I would, if I saw that, I'd be like, burn it.
Yeah, burn it with fire. Okay, so how is
horrible.
So if you want to get this fat injection, how does it work? Well, it's non-surgical. It's done under the office. It does have to be done by a licensed medical professional, which that varies from state to state. Whether that has to be a doctor or can it be a nurse practitioner. So you get numbed up. They inject the fat. It's actually pretty simple to do. It's almost like injecting filler. About 24 to 48 hours after you inject it, the stem cells of your body start to get into the fat and start to kind of incorporate it. By 2 weeks, the fat has matured, and by 4 weeks, the fat cells are definitely integrating into the host cell tissues, and by 6 months, there's stable results with all of the fat being integrated, and that's kind of your final result. So who's going to use this product? So it's used for certain things. So age-related fat loss. So we talked about people that get older and their face hollows out. This would be potential use of it. They said body contouring, so that'd be like you had asymmetries to your body at certain points. You could use the fat grafting to kind of even it out, or use it for enhancement. Like if you wanted to get a little bit fuller breast, you can use it for that. I have actually done fat grafting, classic fat grafting from liposuction on the breast a time or two. There are times when that's useful. So breast augmentation, hip dips, if you got like a little contour in your hip you don't like. If you go and get liposuction and something goes wrong and there's like a hollow space, you could use this product for that. Cellulite dimples, or basically anywhere where you have volume deficiencies. So there are uses for this. So that it's like, okay, product exists, there is a use. Okay, good. So then what are the risks? Really pretty small. Pain, swelling, infection is always a risk. You know, reabsorption, like you mentioned. I didn't notice, and I'm going to have to do a little bit deeper dive on this, if there's been any reported cases of the fat embolism. Because you know when we talk about Brazilian butt lifts and people dying, it's generally due to the fat getting into the bloodstream.
Right.
So I wonder if this product has had any of that. I didn't see any mention, but I didn't pull all the studies on it.
It'd be cool if there was like a lower risk associated.
Yeah,
with
right?
it.
Yeah, exactly. Yeah, and I'll tell you why the risk is probably low, because although you could enhance a butt with this, I don't think anyone's doing that. Although, I do have a before and after of...
Well, you wouldn't think anybody would be sticking, like, Home Depot supplies in their butt, but they do.
That. So who's the best candidate for something like this? Oh, wait. Oh, so Brenna. All right. Brenna jumped in.
There's a butt.
So this is off a webpage that was advertising Alloclae results. And I look at that, and I'm like, it looks pretty good. I mean... Yeah. But I honestly am questioning... She
could have gotten those results by just doing squats, but...
Yeah, but that takes work.
I know.
I honestly question if this...
Squats are cheaper.
They are cheaper. So, Brenna, you hit the nail on the head. I question if this is real. And I'm not going to call out like whatever place I pulled this from, but I honestly question if this is a real example of a before and after of Alloclae, which is the cadaver fat, because... Let's break down the cost, and this is where I think it's not going to be something that's used a lot. A 12.5 cc vial, the ones that we showed on the camera, are $4,000 a piece. 4,000. 25 cc's, 6,000, 50 cc's, 10,000, 100 cc's, $18,000. So
that girl probably has like a $20,000 butt.
Way more than that.
Really?
If that was really from this product and they paid for that, which maybe they got it as sample just to get a before and after out there, in order to augment a butt, you're typically looking at like 400 cc's per side. is kind of like the bottom, like the minimum. That's 800 cc's because you got to do both sides. You're then looking at like $150,000 worth of product. Like, it's not sustainable. Think about something smaller like a breast augmentation. If you're doing a really small augmentation on someone, that would be like 250 cc's for an implant, 500 cc totals. That's like a little less than $100,000. Like, this is not sustainable for doing large volume replacement. So what does that mean? Well, the only people that are going to do it are either people that have just infinite money or people who just want like a really small,
Said the Kardashians.
Yeah, the Kardashians. Either that or just people who want like a really small augmentation. So for example, if you wanted to be, let's say something manageable, like if you want to go up a quarter of a cup size, okay, that's roughly 50 cc's. You need both breasts, so that's 100 cc's. You're looking at $18,000 to do a quarter cup size increase. Like, yeah, right? Like, nobody's going to do that. I don't think. I don't think people are going to do that. I don't think I could get my patients to pay $20,000 for a quarter cup size breast augmentation. Yeah, I just don't see it happening.
No.
So I do think that the product is good.
It's just not there yet.
It's too expensive.
It's kind of like when they first came out with cell phones, when all the cell phones cost $18,000.
Right. Maybe as like time goes on, it'll get better and it'll get cheaper. I think the product is good. I do like it. But look at it. It's just cost. Yeah. Like if it's too expensive, no one's going to do it.
Yeah, it's not marketable yet.
Okay. So, would you get the fat from a cadaver or a dead body injected into your body? It's a good question. There's a new product called Alloclae, which is basically an off-the-shelf fat grafting that's harvested from cadavers. This is an FDA-approved and regulated product. It's actually pretty safe. They scan everyone for diseases. They process the fat properly. They use gamma radiation to make sure it's sterile, and then they package it up. And you can take this product off the shelf and use it as a filler for like something like fat grafting, or even as you would use like a hyaluronic acid filler. And I think there is a use for this because there are people out there that want fat grafting or fillers, but they don't have enough fat on them, or they just don't want to have surgery because this actually is done in office. And I think that this product is pretty good, honestly. I saw some befores and afters that look pretty good, but there's one small problem, and that is cost. A 12.5 cc vial runs you about $4,000. To get 100 cc's of this, you're talking almost $20,000. And so for something like breasts, that means that if you wanted to go up, say, a half cup size, you'd have to have $40,000 worth of this product, and no one is going to pay that. So I do think the product's good. I just think right now cost is an issue. And really the only uses of this are going to be for small injections, maybe the face or to correct some stuff. But it is an interesting product. I don't personally use this, but I'm keeping my eye on it. So, all right. This is kind of a fun but informative segment. I'm going to reveal what I think are the best traits for a plastic surgeon to have. But before I do, what do you guys think? And just maybe give me one or two. Like, I mean, you guys have been on the show for a while now. So what do you think's a good trait of a plastic surgeon?
Like personality?
Just, yeah. Well, I just mean, like more traits. Like what are, I guess personality traits. Yeah, personality traits. Like their inherent qualities.
Not pushy.
Okay, that's good. I like that. I do agree. I don't like, used car salesman type people that are pushing stuff. I agree with that. So, Brenna?
I'm trying to think that's not just like basic stuff.
Sorry to put you on the spot. It's part of the show. You get put on the spot. But you're not expected to come up with anything great. You want to put on the back burner?
I had something and I forgot.
Okay. It's okay.
Sorry.
No, don't worry about it. It's kind of a random question, right? It's like, well, it's like, what makes the great trait of a producer? I mean, if you asked me that right now, I'd be like, I don't know. I mean, I know what a good producer's like, but it's hard for me to name a trait. I guess
honesty. Like they're like, good. Oh, this wouldn't really look good with your
very good
body type, kind of. Yeah.
Okay. Very good.
Transparent.
I like both your answers. All right. Well, I'm going to give what I think are my traits, and the first one is kind of the obvious one. I think that them being a actual plastic surgeon is probably the most important.
I was going to say board certified, number one,
but that's not really a trait.
Like personality.
Yeah. Right. Exactly right. That's more of just okay. By the way, if you're
minimum,
it's a minimum, right? Make sure they're actually a board certified plastic surgeon, American Board of Plastic Surgery. Okay. So mine are kind of different. So the first one I put is I think they should be a really good listener.
Mm-hmm.
because one of the most common reasons where people are unhappy with plastic surgery is because they got an outcome or result that they didn't expect or want.
Yeah. So they just like, I feel like plastic surgeons could easily just do like, no, you want this.
Yes.
Because this is what I do.
Right,
for
exactly.
everybody.
And so I think one of the, I don't want to say hard parts of my job, but one of the more important parts of my job when I'm seeing new consoles is actually talking to them and figuring out exactly what it is they want. And to do that, you actually have to listen to the patient, which takes time, right? It slows things down, but it is very important. So I think being a really good listener is very important. I think having an artistic side. I don't think a lot of doctors are really artistic. They're more science-based, they're more analytical. And I personally believe that plastic surgery really requires that kind of artistic eye to look at something and in your mind come up with a result and create that. And I don't think a lot of doctors are good at that. I do think that's why plastic surgeons have kind of a type. They do tend to be, like, at least the good ones tend to be a little bit more artistic. And I'm definitely like that. Like, I'm really into music and music production. I mean, I love drawing and just art in general. And so for me, it's kind of a good fit. But I think having an artistic side. And so, like, how would you, if you were going to go do a consult, you might ask them, like, do you consider yourself an artist? You know, what do you do that's artistic? If somebody asked me, and I've had people literally
pretty much are molding somebody's body.
Exactly right.
Yeah.
And I've had people ask me that in consult. They're like, do you consider, yourself an artist? Like, yeah.
Like Michelangelo of plastic surgery.
Yeah, that's right. The Wizard of Tatas. Okay. The next one, I think.
Weirdo.
The Wizard of Tatas. You like that? Yeah, funny. All right. Okay. I think another one that's super important is to be meticulous. I firmly believe that the difference between either a good and a bad outcome or a phenomenal and a just okay outcome comes down to very, very minute things that you would do in surgery, meaning the way that you do a dissection, the way you do a closure. I can tell you in a lot of surgery fields, because I was general surgery before I was plastics, like there's not a lot of meticulousness in a lot of fields. It's like, oh, I'm going to close this incision. Well, I'm going to close it with a stapler. I mean, there's nothing meticulous about it. A lot of surgeries are very mechanical, and I think that meticulous nature does make a difference between, a really good plastic surgeon and one that's not so good. In fact, I will not let the scrub techs cut my suture, which is weird. Almost all surgeons, when they throw a suture, the scrub tech cuts for them. I will not allow someone to cut my suture because I want it done exactly right. And I know I can do it, and I don't know if someone else can do it.
Right.
And it's weird. Like, people, when I work with a new scrub, like, they'll go to cut. I'm like, no, I cut my own suture. And I've got a really slick way to do it. I basically palm a scissor inside where I'm using the instrument. And so basically, I'll throw a stitch, and I can flip the scissor up with my finger and cut in, like, 1 second. And it's actually pretty slick to watch. But yeah. So, like,
video
that's it.
coming soon.
Huh?
I said video.
I really do need to I'll take a video of that. Taking time to inform the patient and that kind of goes with not only being a good listener, but just being a good communicator. I think patients that are well informed of a procedure and know what's going to happen and know what to expect do better.
Yeah.
They just do. I mean, there's research to back that up, and that requires, communicating with the patient. So doctor-patient relationship. Always available. I am always available. Any one of my patients can get a hold of me 24/7 by calling my office number. And I think that's important because, if you do lots of surgeries, eventually something will pop up. And if you want to prevent something small from becoming something big, you need to get on top of it.
Yeah.
And I know for fact, and I know this from doing my malpractice stuff, that there are a lot of times where patients have things happen and they can't get a hold of the doctor. And then it's like, what do? They go to the ER, but the ER doesn't really know what, surgery they had or what to do.
Right.
So I think always being available. And then the last one is one, Brittany, you kind of mentioned this. I put ethical, even if it costs them money. So being able to say no to somebody. Like, you know what? You don't really need this surgery.
Yeah.
Or you know what? You don't really need to do implants and a lift. If you just do a lift, it's going to give you the result that you want. So
that probably falls. I feel like that falls under being pushy too.
I agree. You're right. Yeah, not being too pushy. Yeah, absolutely. So I know these are kind of weird because a lot of people might say, oh, they need to be really smart or whatever. But to me, like, these are things that are the most important as far as what makes the best traits for a plastic surgeon. So, All right, so what makes the best traits for a plastic surgeon? Well, if you're asking me, I'm going to come up with some things you might not have thought about. I do think that being a plastic surgeon that's actually legit and board certified is probably very important. But other things like being a good listener, talking to a patient to determine what exactly it is that they want to have done. Because a lot of times when patients don't have plastic surgery, it's because they didn't get the result that they want. I think meticulousness is also super important. Being a good communicator. And we talked about a lot of things in our segment today on our show that I think are the best traits of a plastic surgeon. If you want to hear them all, go and check out the segment. All right, last one. You ready?
Yeah.
We're playing a game. It's 2 Truths and a Lie, medical edition.
Okay.
Here's what's going to happen. I'm going to do these rapid fire because we got to kind of wrap up here. I'm going to list out 3 medical statements. 2 are true, 1's a lie. And both you girls have to pick which one is the lie. Ready to go?
Yeah.
2 truths and a lie. Here it comes.
I'm ready.
All right. A woman's breast implant deflected a bullet and saved her life. That's number 1. Certain cysts in the body can grow hair, teeth, or even bone. And 3, a plastic surgeon once accepted a patient's gold teeth as payment for a facelift.
The one about the first one.
The first one, a woman's breast implant deflected a bullet and saved her life. Bruno, which one's the lie?
Can you repeat the second one for me?
Certain cysts in the body can grow hair, teeth, or bone.
I don't like that.
Sounds gross, right?
Yeah. I think that's true, though.
Okay. So is it the breast implant deflected a bullet, the lie, or plastic surgeon accepted gold teeth for payment for surgery?
I think the gold teeth is a lie.
You're correct. There actually is a case report of a woman that had a large breast implant that got shot, and it deflected the bullet so it didn't go in her chest. It's pretty crazy. I've heard of that one before.
It like deflected and it went away, or just like was lodged?
It
sounds crazy.
Yeah, it kept it from going into her heart. Yeah.
Oh, okay. Well, I could see that. I was thinking more of
like
ricocheted.
Yeah. Oh.
Like, that doesn't sound right.
I probably didn't say it properly. Okay, next one. Some people break out in rashes when they see the color red. Next, some people have a condition where their sweat is blue, green, or yellow. Third one, some people develop hives when they cry. So which one's a lie? You get rashes when you see the color red. Some people have a condition where their sweat is all different colors. Or some people get hives when they cry. Bernie, you have to go first. Sarah went first last time.
I think the hives one is true. I think they're both crazy. I can see how the sweat could be a thing, but I don't want to believe it because I'm going to go with that one. I think that one's a lie.
Some people have a condition where their sweat is blue, green, or yellow. Okay. Do you like that one as the lie, Sarah, or breakout and rash?
I think the lie is looking at the color red.
That's true.
Okay,
yeah. Okay, that's a lie. That's the correct one. Yeah.
Okay.
So chrome hydrosis is a condition where sweat can be blue, green, or yellow. And then aquagenic urticaria is a condition where water causes you to break out in hives, which it does include your own tears. That's really rare. I've never heard of that one. But okay, next 3. A woman performed a home nose job using an industrial file and superglue. A man once successfully sealed a major head wound with Gorilla Glue but had to have surgery to remove the mass. A woman tried to bleach her own skin with household bleach and ended up with severe burns.
These are horrible.
I know.
So I don't like any of them.
Which one's a lie? Home nose job? Successfully sealing a major head wound with Gorilla Glue? Or a woman bleached her own skin and ended up in the burn unit?
I'm going to say
2 are truth and 1's a lie.
The first one is a lie.
Then the home nose job's a lie. Brenna?
Wait, can you reword? What's the second one say?
A man once successfully sealed a major head wound closed with Gorilla Glue, but had to have surgery to remove the glue.
I want to say the first one also.
You guys are both correct.
I feel like you did a segment about Gorilla Glue in somebody's head before.
We did do that one? I don't know.
Something with Gorilla Glue.
I feel like I also remember just Gorilla Glue being like stories on the news, like growing up. So
these all kind of have themes too, by the way. Yeah. That theme was like people doing them stuff on. The next theme is weird body congenital anomalies, meaning things you're born with. Okay.
I like how they're related.
They are all related. Okay. About 1 in 10 people have an extra spleen in their body and don't know it. That's number 1. A rare genetic mutation can cause extra fingers to grow at puberty. That's 2. Some people are born with all of their major organs reversed, left to right, including their heart, meaning the organs are on opposite sides. So, which one is the lie? 1 in 10 people have an extra spleen. there's a rare genetic mutation that caused an extra finger to grow at puberty, or some people are born with all their organs completely reversed.
I don't believe the second one, because I feel like if you have extra fingers or something, you would be born with it. It wouldn't just start when you hit puberty.
Same.
Correct. That's the lie. There actually is a thing where all your organs reversed called situs inversus. I've actually seen it. It's really weird on
Do they
X-ray.
function fine?
Huh?
Do they function okay?
Yeah, totally normal.
Oh.
Just normally the heart's on the left and the liver's on the right. These patients.
That's
it's all
crazy.
reversed. Yeah.
So they're doing like the Pledge of Allegiance and they're opposite.
Yeah, exactly
Why are you
right.
doing it that way?
Yep. Okay. Two truths and a lie. A man once sneezed so hard his eyeballs popped out of his sockets. A man once accidentally inhaled his own dentures and they weren't found for 8 days. A man once survived a nail from a nail gun being shot into his brain. Two truths and a lie.
The dentures.
Yeah.
Dentures?
8 days?
8 days.
Yeah, I'm gonna go with that one too.
That's actually true. No, meaning that's not the correct one. The lie is a man once sneezed so hard both his eyeballs
What?
popped out. Yeah.
I feel like I've seen something on that.
Yeah, your eyeballs are pretty attached.
I
Like
mean,
all
some
those stuff
people-
in the movies where like the eyeballs
Yeah.
like pop out. Like that doesn't really happen.
I feel like I've seen a guy do that though, like on TikTok. Like he can actually just like
He might be able to like
yeah.
coming out of the socket.
Yeah.
Oh, sorry,
I
yeah.
guess that.
Okay. Next one. Some clinics in South Korea perform a smiling procedure to permanently lift the corners of the mouth. A social media trend once had teens rubbing banana peels on their face to cure acne, or a Brazilian spa briefly offered UV eyebrow tanning to darken their eyebrows. So, do South Koreans perform smile procedures? Did social media trends have kids rubbing banana peels on their face? Or did Brazilian spas offer UV light to darken your eyebrows?
UV light.
Think
I want to
that's
say
a lie.
that one's a lie too, because there's like tinting, like
UV light makes things lighter.
yeah. I
You
don't
guys are
believe
good.
that one.
That's correct. Very good.
Tried to stump us.
You guys are doing pretty good.
I've seen the banana peel one. That's why I was like, I know that's true
It makes your
because I've
hair
seen
lighter. It doesn't make your
Yeah.
skin lighter.
that. Right.
Okay. Some people can gradually lose their fingerprints from chronic spicy food intake. Some people can get randomly drunk without drinking due to yeast in their gut fermenting sugar. Some people have sweat that smells like maple syrup.
The first one is a lie.
Some people can gradually lose their fingerprints from chronic spicy food. Brent?
I don't believe that either. Yeah.
Yeah, dude, these are, man. You're right. That's the lie. I tried to come up with stuff that was like crazy. but
Imagine you have an iPhone and you know the fingerprint thing.
Yeah, it wouldn't work
You
anymore.
can't. Yeah.
Okay,
There's no.
maybe I'm
Be a
just bad.
lot of people with
I stumped you guys with the first couple.
undocumented.
Yeah.
Okay, a man lived for years with a 3-inch knife blade in his head without knowing it, but was found randomly on a scan. A patient was struck by lightning and became fluent in a new language. There's a condition where one hand acts on its own, doing things without the person wanting it to.
I believe that. Wait, what was the first one again? Sorry.
A man once lived for years with a 3-inch knife blade in his head.
I'm gonna say the second one. It's not true.
The lightning and the
Yeah.
languages?
There's no way.
I'm gonna pretend to think that that one is doable. I'm gonna say the blade.
The blade. So it actually is the second one. It's a lie.
Okay. It's like Spider-Man.
Too bad.
Although it is weird to believe somebody lived for years with a 3-inch knife blade in their head, or that there is a thing called alien hand syndrome where the hand acts independently. I think we talked about that one, though. I probably shouldn't have picked that one. Okay, just two more. Doctors once found a pea plant sprouting in a man's lung after he inhaled a seed. A patient had a contact lens embedded in his eyelid for 25 years before a doctor found it. Surgeons once found a functioning miniature stomach growing in a man's thigh muscle.
The third one. was
What is the
lie.
first one again?
Doctors once found a pea plant sprouting in a man's lung.
I want to
That's
say
the first
that,
one.
but it depends.
That's the first one.
Yeah, I said the third one.
Oh,
Yeah.
Brent-
I asked to repeat it.
Oh, okay.
I think it's that one because it doesn't have like I don't know if it needs sunlight, but I'm gonna go with one.
So 3 is actually the lie. Actually, that happens.
Dang.
I guess plants can grow for a short time without sunlight, so it was sprouted. They said it was 2 centimeters, like it had sprouted.
Gross.
All right, last one. There's a rare bacteria that glows purple inside wounds when it infects them. A parasite called Loa Loa can crawl across the surface of your eye while you're awake. There are tapeworms that can grow up to 30 feet long in human intestines.
Ew. I don't like any of these.
The one that glows.
Glowing
I
bacteria?
believe that.
You think that's the lie? Or you think that
Yeah.
was true?
I'm gonna go with that one too.
All right, that is the lie. However, I will say there is a bacteria
That glows.
Yeah.
that it
I
doesn't
can believe that
glow.
there's bacteria that glow for sure. But
There is a
not in
bacteria.
purple in
like
the
that
body.
fungus on Entangled. I think
fungus. I don't know.
there's like mushrooms that glow and
Yeah, there is like
Entangled.
that plankton, but there's a certain bacteria that's actually a really
Air
bad one that
plankton.
is blue-green, and it kind of looks iridescent but doesn't really glow. That's why I thought it's like, okay, well that one's believable. Man, I suck at these. I stumped you guys the first couple times, but you guys like schooled them at the end. You guys did good.
Thanks.
We're
That was fun.
informed.
You guys
I
are
enjoyed
informed.
that.
Yeah, it's kind of fun, kind of different, you know. All right, I think that's all the time we have for this week. Thank you guys so much for tuning in. We really do appreciate it. We hope you had an amazing Thanksgiving. We'll be back live next week to talk about the next segments on Nip Talk.
Bye.
See you.